The Society's rule states Vincentians help people in poverty help themselves whenever possible. As Sharon Dennis shows us, the Society, Ascension Healthcare, and Catholic Charities are partnering to help people create a path to a more stable future in Detroit.
I believe in me. I believe in the power of God. I know I didn't come here by chance. I know I'm here for a purpose.
Constance Moten says that purpose is working to pull yourself up to create a better life and a brighter future. That's where Bridges to Hope comes in. Bridges to Hope is a no-cost program offering life planning lessons for people interested in creating a more stable, secure future. It is a collaborative effort of the Society of St. Vincent de Paul, Ascension Healthcare, and Catholic Charities of Southeast Michigan.
So what has been the most eye-opening thing that you can name in this class that's just been your epiphany, your aha moment?
Bridges to Hope is hopeful, and it stands for helping others prosper through empowerment. And we're really good at direct service and advocacy, and we want to take it to another level and help people help themselves. So Bridges to Hope is helping people create sustainability.
Bridges to Hope participants learn about factors contributing to poverty, as well as resources and ways to help them get out of their situation.
They help you get out of poverty by teaching you different things about poverty and different skills, and we all share resources and things to help us do better.
Everything. Church, relationships, kids, jobs, about the city, life what we went through, everything.
We talked about what is poverty, which is, not meeting your basic essential needs. And then we learned about the statistics. And then after that, we scoped out a mental model of poverty. So where are you in your life? So we basically looked at a model that can help us to be self-sufficient as an individual.
Dr. Cynthia Tagg, Vice President of Community-Based Health Services at Ascension St. John Providence, sees Bridges to Hope as offering a hand up, not a handout.
In fact, a lot of the people that we work with are working, and many of them working more than one job, trying to make ends meet. But they need some tools, and also people just need social support. So this Bridges Out of Poverty program, which we call Bridges to Hope, helping others prosper through empowerment. That's what it's about, helping them to be empowered so that they can better themselves and make better choices.
Bill Hill, a Vincentian with the St. Peter's-St. Paul Conference, says the Society's element of personal contact between its members and those struggling is key to helping people move out of poverty to self-sufficiency.
I've always thought that it was important to have some one-on-one kind of help for somebody to get them out of the situation we're in. There's so many people that come back to the shelter every week, and you just can't see a way out. And so I was interested in that when I was volunteering.
Participants learn there are different types of poverty, including temporary situational poverty and long-term generational poverty.
Poverty is not just about finances, but it's an array of different things that make up how we actually tackle poverty, I guess, so to speak, or how we actually can really address poverty, because it's not a one-sided approach that is actually needed. So there's so many facets of poverty, whether it's situational, generational, relative.
Cassandra Jackson, St. John Providence Community Health Manager, says experiencing poverty is like a day-to-day fight to keep your head above water.
In our Getting Ahead program, they call it being in a tyranny of the moment. And so you're not trying to figure out what you're going to do 6 months from now. You're trying to figure out what you're doing 6 minutes from now. And so it is a struggle.
Takia Calhoun says an important part of the Bridges to Hope training is to help people see and plan for a better future, rather than focusing on short-term needs.
Yes, I want to go back to school. I wanted to show my children that I am pursuing my dream of, getting my bachelor's and my master's, and maybe even that PhD. However, I can't see past today, because all I'm concerned about is, are my kids safe? And I won't have any utilities. Will I have enough food to give to my children and myself? So all I'm worried about is today. How can I take care of today? So that's the tyranny of the moment. I can't see past today. So the chances are of me pursuing that goal of returning to school or getting off of welfare assistance is something that I don't even think is attainable.
Program leaders believe the classes truly make a difference in participants' lives.
The results are worth the effort, definitely. When you hear stories from individuals that have graduated from our program, and you hear that they have enrolled in college, and you hear that they have applied for their first home loan, or you hear that they have gotten a job that is beyond the minimum wage, that makes you hopeful. That's when you know that your efforts are truly paying off in the community.
Through his work with the Bridges to Hope classes, Bill appreciates the opportunity to live out his Vincentian values, helping people in poverty help themselves.
I try to see Christ in those people. And when I serve at other places down here, I pray often at night. I say, God, show me that one person that you want me to talk to mentor to in my service assignments.
The students are grateful for the helping hand.
My goal is to go out and help many people as I can. Same way the kid helped me. I got to pass it forward. I have to.
8 weeks ago, I was getting to know myself a little better. You know, getting to know God, getting to understand God and what place He has in my life and how that can help me go through any obstacle that's in my way. I was looking for employment. I found a job yesterday.
I believe I'm going to succeed because in a year from now, I plan on being a Wayne State University graduate. I just have so many plans, so many things I want to do because I was destined for a purpose. So I plan to just shoot off like a star, like go far.
That's the goal of Bridges to Hope, to help Tiara and others realize their dreams. For Our Faith in Action, today's Society of St. Vincent de Paul, I'm Sharon Dennis.
Seems it's a success. 48 people began and finished the pilot program, and all report their stability improved.